The prize lectures are the jewels of the EASD programme every year. From the Claude Bernard, where you get the whole gamut of someone's life and their research over that lifetime, to the Minkowski. Now, the Minkowski is for an early career researcher, and Teresa Mezza is the person who's won it this year. So first of all, congratulations.
Thank you very much. Good morning, everyone.
And it's terrific to have you here with us. Was it a surprise to be receiving this award?
Yeah, absolutely. It was absolutely a surprise. And I still remember when the president was calling me saying, "You are the winner this year." So this is for me really important because actually the EASD shaped my path. I received several other opportunities to grow up. So this prize is a kind of confirmation that I'm working in the right path.
And no pressure, but the giver of the Minkowski lecture often goes on to do very good things in diabetes.
Yeah.
As I said, no pressure. But so tell me about your research.
Yes, I'm a clinician, so
a clinician from Rome?
Yeah, from Rome, from the Fondazione Policlinico Gemelli hospital. Is one of the largest hospitals in Italy, and I'm working especially on type 2 diabetes. But what is real unique in my clinic is that I'm following up all the subjects that underwent partial pancreatectomy, so I'm able to see what is going up and before and after this kind of surgery. This is a way to understand better the progression of type 2 diabetes, and also to collect pancreas samples that are really useful to understand what is going to happen inside the pancreas and where is the very origin of diabetes.
So it's a really good way of thinking about the natural history of type 2 and thinking potentially about how to predict it.
Yeah, absolutely it is, because actually in the natural history of type 2 diabetes, what we have is the loss of beta cell mass and also the beta cell function. And if we think at this kind of surgery, you actually have an acute removal of the islet mass. So meaning something that will take years and years in the natural history. So it's a way to understand who is going to adapt to compensate to the loss of mass, and people that cannot adapt, cannot compensate, they are developing diabetes and hyperglycaemia.
What has it told you so far, this approach?
That absolutely the translational research is really important. So it makes me focus on the real physiology, and also I learn a lot from my patient, because actually we need to do research to find out a better cure, a better way to improve their quality of life. So it's a kind to make me real on the roots of everything.
And potentially this has very wide translational impact.
Yeah, I hope so. Actually, we are working in the latest research on find out biomarker, very easily measurable biomarker that can help us to understand before hyperglycemia, even before any kind of disease, people who are going to develop diabetes and people that have a low risk. So we can predict people that need our attention before and potentially our treatment before to avoid hyperglycemia and complication.
And so this would be really an alternative approach to the the kind of the genomic approach, where people are doing polygenic risk scores, for instance, because that never seems to me to be a very practical way to go forward for mass screening.
Actually, I guess the pathophysiology is very complex, and of course, the polygenic disorder cannot be the only one. It's one player among several others. So we need to find out the way to understand as much as possible with the best biomarker and the more easy to use biomarker in clinical practice.
So take me forward 5 years, perhaps 10 years. What will you be doing, apart from enjoying a new family?
I hope I'm keeping understanding and studying more, asking for better questions, because I guess we need more and more research on this topic. The type 2 diabetes is a real heterogeneous disease, so it's not simple. And I'm also hoping for my future that I still have the chance to work with young people, because young people give you the meaning of the future. So it's important also to train the next generation of scientists.
That was going to be my final question to you, because there are so many pressures on young researchers at the moment, so many different competing things. I mean, it's not just the work-life balance, which many people find is so difficult. It's, pressure to produce papers, it's pressure to get grants. It's a huge burden. How do you think that perhaps things could be made easier or better for young researchers?
Yeah, this is a real hard question, because I'm just 40, so I still feel the pressure of myself, so I can really understand. But what is my motto and my suggestion is keep doing what you really believe. No pressure about paper that need to get out and, metrics and all this stuff. If you believe that something is right, just keeping doing on what you believe. This is what was working for me, actually.
It's a fabulous message, and I just remind everybody that Fred Sanger published 5 papers and got 2 Nobel Prizes. Just saying. Thank you so much for being with us. Congratulations. It's a terrific honour. And I know that you are now, in the nicest sense, a marked woman, because we are going to be looking for your name as we progress through the next few years, because you will be a superstar of the future, I'm quite sure. Thank you so much.
Thank you.
It's so wonderful interviewing the prize winners. It's just joyful. But there'll be more of EASD TV very soon.